Hello juniors. So in the series of upper limb, today we are going to continue with cubital fossa. In today's video, we will be covering features of cubital fossa, its boundaries, content, and its related clinical anatomy. So first of all, cubital fossa is an important topic from the university exam point of view. Starting with the features of cubital fossa, what does it mean, cubital fossa? Cubital in Latin means elbow, and fossa means hollow or depression. So many of the students confuse in fossa and foramen. Fossa is hollow or depression, and foramen is hole. This would be a hole uh, from which any substance can be passed. And fossa is a depression like this. This is the depression, this is fossa. Cubital fossa. It is a triangular depression situated in front of elbow. Showing you. This is the elbow. Homologous with popliteal fossa. We will be covering popliteal fossa in lower limb. So these are the general features of cubital fossa. Cubital fossa means elbow. Fossa means hollow or either depression. It is a triangular depression situated in front of elbow, homologous with popliteal fossa of lower limb. So we are done with features. Now we will be doing boundaries. Boundaries are, this fossa is triangular depression, so we will be doing its base, apex also. Laterally medial border of brachioradialis. This is medial, this is lateral side and this is medial side. So what it is saying, laterally medial border of brachioradialis. This is lateral muscle. This is the lateral boundary of cubital fossa. It is formed by a medial border of brachioradialis. This is the medial border. Can you see? This is the medial border of brachioradialis. This one. This one is brachioradialis muscle. The medial border of brachioradialis forms the lateral boundary of cubital fossa. Next, medially. Lateral border of pronator teres. This muscle. Behind the white fibrous aponeurosis. Below the white fibrous aponeurosis is the pronator teres. So the lateral border of lateral border of pronator teres forms the medial boundary of cubital fossa. So this is cubital fossa like this. Can you see this triangular? A bit triangular. This is not perfectly a triangle, but it seems to be a triangle. Base directed upwards. Imaginary line joining two epicondyle of humerus. From this, it would be more clear to you. This is the base of cubital fossa. Same here, this is lateral side, this is medial side. Base is formed by imaginary line joining two epicondyle of humerus. This is humerus. Imaginary line joining two epicondyle of humerus forms the base. I think it is a bit simple and clear to you. Apex. Now, apex. Apex directed downwards, brachioradialis crosses pronator teres. This is brachioradialis muscle. When it crosses the pronator teres, it forms the apex here. So apex is directed downwards and base is directed upwards. I think it is a bit clear to you. Nothing difficult to understand here. We are done with boundaries. Now I'll be doing content. Roof. Roof is formed by skin. This is the our cubital fossa. Here it forms the cubital fossa. So the skin, superficial fascia containing medial cubital vein. Firstly, first layer, most upward layer forms the roof and downward forms the floor. Which means when I cut this cubital fossa in transverse section, this is radius, this is ulnar. So part above is the roof and here is the floor. This forms the roof, this forms the floor. Roof is formed by skin, superficial fascia containing medial cubital vein. This is superficial fascia containing medial cubital vein. This is very important to know that superficial fascia contain medial cubital vein, median cubital vein, which is generally a site of intravenous injections. This median cubital vein, it is formed by joining of basilic vein and cephalic vein. Can you see? This is cephalic vein, this is basilic vein. Formed by both of them. This is median cubital vein. Superficial fascia containing median cubital vein. Lateral cutaneous nerve of forearm with cephalic vein. And medial cutaneous nerve of forearm with basilic vein. Showing you this. This diagram is taken from BDC. This is our cubital fossa. This is our median cubital vein formed by basilic vein in medial side and cephalic vein in lateral side. So basilic vein and cephalic vein forms the median cubital vein, and further lateral cutaneous nerve of forearm with cephalic vein. This is lateral cutaneous nerve of forearm, this one. It continues with cephalic vein. This is cephalic vein. So all these structures are present in roof of the cubital fossa. First one, cubital vein, median cubital vein, lateral cutaneous nerve of forearm with cephalic vein, and medial cutaneous nerve of forearm with basilic vein. This is medial cutaneous nerve of forearm. It continues downward with basilic vein. So contents of superficial fascia is median cubital vein, lateral cutaneous nerve of forearm, and medial cutaneous nerve of forearm. Below to superficial fascia, there comes the deep fascia and then bicipital aponeurosis. What is aponeurosis? This is the aponeurosis. Aponeurosis is the flattened tendon of this bicipital muscle. Bicipital muscle, not bicep brachii muscle, and its flattened tendon, that is called as aponeurosis. We are done with the roof. Now for floor. Floor is formed by brachialis muscle and supinator surrounding the upper part of radius. This is the cubital fossa. This is our radius, ulna. So part above the line forms the base of the cubital fossa. So above the radius, supinator muscle forms the floor, and above the ulna, brachialis forms the floor. This part does not contribute in floor formation. Only above the bones form the base of the cubital fossa. This is brachialis muscle, this is supinator muscle. Supinator muscle goes in round fashion and covers the radius bone. So the upper part of supinator forms the floor of cubital fossa. Now the contents of cubital fossa. We are going to remember contents of cubital fossa by this mnemonic MBBR. From medial to lateral, contents are median nerve, brachial artery, bicep brachii tendon, and radial nerve. Let me show you here. This is our contents of right cubital fossa, MBBR. This is median nerve, brachial artery, bicep brachii, and radial nerve. These four forms the content of cubital fossa. This is from Vishram Singh. So from this image we can fully revise our cubital fossa. This is brachioradialis, this is pronator teres. Contents would be MBBR, median nerve, brachial artery, tendon of bicep, and radial nerve, MBBR. Further to MBBR, we have this diagram. This is the transverse section of cubital at the level of cubital fossa. This is our radius, ulna. Through this diagram, we can see that radial artery is superficial as compared to ulnar artery. See, you can see here ulnar artery is under the cover of superficial and deep head of pronator teres. This is pronator teres, superficial head, deep head, and ulnar artery is deep to both of the heads of pronator teres. Whilst radial artery is superficial, radial nerve is under cover of brachioradialis, and median nerve is under cover of superficial head of pronator teres. So here there is nothing to learn. You can simply draw the diagram, practice it once or twice to draw the diagram, and you can simply, while seeing your diagram, you can write it down. There is nothing new in the theory of anatomy. In the theory of this topic, what we are seeing, what we see, we actually write it. So ulnar artery is under cover of pronator teres, radial artery is superficial, radial nerve is under cover of brachioradialis, and median nerve is under the pronator teres. This is the bicep brachii tendon. So this completes the contents of cubital fossa. In clinical is not much in this topic. Median cubital vein is often the vein of choice of intravenous injection. As I have told you earlier, median cubital vein We often give intravenous injection at this site. Blood pressure is universally recorded by auscultating the brachial artery. As you must have done recorded blood pressure, there you have auscultated brachial artery in the procedure of taking blood pressure. So here we are done with features, boundaries, contents, and clinical anatomy. Hope you find this video a bit helpful for you and for your university exams. Thank you.